Welcome back to BT on the Couch with Occupational Therapist Sue Barlow. June being Brain Injury Awareness Month, so thanks for coming on. An important topic when we talk about keeping our brains healthy. But this idea of concussions and traumatic brain injuries, concussions, where does that fall on the spectrum of injuries to the brain?
Yeah, absolutely. So a concussion technically is a traumatic brain injury, but it's a mild traumatic brain injury. One of the distinctions is that with a concussion, actually the symptoms are generally transient, so they resolve over time. Whereas with a moderate severe brain injury, clients generally have impairments that require more intense rehab.
You know, and we were just chatting about the fact that concussions are more common, not just found in professional sport, but, you know, if you take a blow to the head, let's start here. What are the key signs that you have experienced a concussion?
Yeah, that's a very important question. A person needs to present with one of the three conditions, and one of them is a loss of consciousness for less than 30 minutes, loss of memory before or after the injury, and some kind of alteration in the mental state. So that's that sort of seeing stars or being dazed. And so those are the immediate signs, and then there's typical symptoms that follow after a concussion.
And how quickly, if these signs are present there, how quickly do you need to seek medical treatment? Is this something where you wait a couple of days, or if you see these right off the top, you should go in immediately?
I think it really, I mean, the most important thing is the person knows what to do, and that they recognize it is a concussion, and that they have evidence-based information. Certainly if they're playing a sport, you want that person to stop that sport, and the worst thing someone can do is actually re-injure themselves. So, you know, depending on the symptoms, you know, clients will have initially physiological symptoms, so headaches, nausea, dizziness. So depending on sort of the intensity of that, they may want to go to the emergency room. But the most important thing is that they have their early education, and that's something as occupational therapists we talk to clients quite a bit about. There's some guidelines that people need to know to have restorative sleep, to know what to do to take a brain break and have a gradual resumption of activities. But going back to your question, I think just that awareness, and as OTs, we're working with a whole team of people to educate people. So part of our mandate is providing education to other healthcare providers and even family doctors as well. And
you know, we saw some of the symptoms come up on screen as you were kind of outlining what to look for when you're going for that medical treatment. Give us a scope of the timeline. You know, receive the blow, you know you have a concussion. What's realistic? Because from people I've talked to that are experiencing concussion, it can be very discouraging of you're making progress and then you take 10 steps backward. What is realistic for the recovery?
Yeah, that's an excellent question. I mean, every concussion is unique for the person. However, the rates of recovery, typically people will have complete resolution of the symptoms between 1 to 3 months. Within a year, 85% of people will have 100% recovery, 10% will have one symptom, and then 5% will have more than 4 symptoms. So as an occupational therapist, I work with people with the persisting post-concussion symptoms. And often where I start with people is helping them really to understand those symptoms, because it could be that person never had that information, or that they've had risk factors, they've had multiple concussions and a few other variables which puts them at risk for having these persistent symptoms. And then it's about really learning to manage the symptoms so that they can increase their ability to go back to their normal everyday activities.
And if you're in that position where you want to expedite the recovery, is it easy to say, hey, I'm just going to sleep this off and just try and sleep through the entire experience and get past this, or is that just a myth?
You know, that is an excellent question, and it is a bit of a myth, actually. You know, I think traditionally in medicine, family doctors would say to their patients, well, you've had a concussion, go home and rest. So there is some truth in that people should take a rest for maybe 1 or 2 days, but bed rest no more than 2 days, and actually can be unhelpful for people to do that. And the rest actually is about taking cognitive rest, because as the brain is trying to recover, it takes a lot more energy for the brain to do the things it normally does. So for example, if you had a physical injury, if you fractured your ankle, everybody would say to you, okay, you just need to take some time to rest that ankle and then gradually get back to your activity. You don't want to be immobile because things will get worse. So as an occupational therapist, a lot of what I do is help people understand what is it to take a brain break, because the things that tire the brain are cognitive activity, but actually being in a stimulating environment. So being in a grocery store, there are bright lights and noise, so that's taxing for the brain. And the other piece that can be really tiring for the brain is emotionality. So if people are anxious, they're worried. So it's very hard to not think, right? It's hard not to, to give the brain a break. So as an OT, I help people sort of apply a strategy, how to take a brain break. And, often it's looking at things like meditation, helping people to just calm their mind. There's some theory that the brain goes into a bit of a sympathetic nervous system overdrive, so deactivating that. We give our clients real practical things to be able to do to help them. We say habituate the strategy of taking a brain break so that they can get back to work, get back to being in social environments, and when they have the symptoms, not be scared of them. And
just taking the time to turn the brain off. And I think concussion or not, these are great ideas. And more of these ideas can be found on the website that we're popping up on screen right now, caot.ca, Canadian Association of Occupational Therapists. Sue, thanks so much for coming on.